Let us speak to the National Education, Health and Allied Workers Union, who are calling for a probe into this fire at the Charlotte Maxeke Hospital. Nehawu says it's concerned about the occupational safety measures. Of course, they have a right to be concerned. Nehawu is also calling on government to restore services at the hospital as soon as possible. But we'll have to wait and see if that's going to happen. Let's speak now via Zoom to Nehawu spokesperson Khaya Xaba. Mr. Xaba, good afternoon. Welcome to the Midday View here on ENC. I mean, firstly, you've got members who work at Charlotte Maxeke Hospital. I want to start here. What have they told you about safety measures, their health and safety measures, about risk mitigation measures, about a plan to make sure that things like fire hydrants are in place? Does a hospital ever do a drill? Is it allowed to do a fire drill?
Well, from what I've heard, that has never happened, and they've never seen anything being done in relation to the issue of safety in the hospital. So that's why it was very easy for the hospital to be gutted down without anything being done to the fire to be stopped, and it even reignited on Friday afternoon. So it shows that the hospital was not ready for such an eventuality, and that's why we're calling for immediate investigations so that those who are found to be on the wrong can then face punitive measures.
So as far as you know, your members say there were no occupational safety measures in place. Therefore, the risk was always there that if something like this happened, it will cause a lot of damage.
Yes, but then, I mean, not even to single out Charlotte Maxeke, almost all government departments and the hospital are in a dire state, and they're in a position to provide adequate safety and health measures to workers who work in those in those buildings, including the clients and the hospital and the patients who uses this hospital. So we're worried, and that's why we're seeking an immediate audience with the minister to raise sharply these issues, because if not, then Charlotte Maxeke is just a tip of the iceberg. We're expecting more calamity to befall these institutions.
That's very concerning. Now, you are also calling for the government to restore the Charlotte Maxeke services as soon as possible. But just listening to the kind of damage that's been there, I don't think that's going to be possible to be as soon as possible. What time frame do you have in mind?
Well, we can't really say because we are not structural engineers, but what we can say is that institution is very important in that it saves a vast area of Johannesburg. Moreover, also it serves as a vaccination site. So it's important that it's opened as soon as possible. Also considering that we are facing a third wave. So it will be a very dire situation if when the third wave comes, the hospital is not open. So that hospital is needed because it's being closed puts more strain to our already overstretched public healthcare system. So we need that hospital to open as soon as possible. And we want to applaud our members who did well during a very strenuous time in removing those who were close to where the fire was throughout the night, even in the thick smoke that had engulfed the hospital. So we're happy for our members, and hopefully the hospital will see into it that they are remunerated for that.
Thank you very much. That's Khaya Xaba. They're speaking on behalf of the National Education, Health and Allied Workers Union, Nehawu. They want an investigation into the fire to be done properly, and anybody found to be guilty of anything to be held accountable as the fire at the Charlotte Maxeke Hospital. And their members telling them that the hospital was not prepared to deal with the fire. That's very, very concerning. And according to him, other government buildings and other public hospitals are in the same situation.